I'm Valerie Fleischman, Senior Vice President and Chief Innovation Officer at the Massachusetts Health and Hospital Association. And on behalf of MHA, welcome to today's Executive Insight Series session. This session has become something of a fan favorite within our MHA network, so we're glad to be picking it up again with all of you joining us. Today's theme is Navigating the Tide, an apt title for where our guest joins us from. A few logistics before we start. We will be recording this session for those who aren't able to join us, and all lines will be in listen-only mode. If you have questions during the session, please enter them into the chat below. The questions will come to us, and we'll do our best to address as many as we can toward the end of the session. Following the webinar, we'll be sending out a recording along with a brief survey. I want to take a moment now to thank our 2022 sponsors for their support in underwriting MHA's education programs. They have helped support another tremendous year of our content for our members and for leaders across the healthcare continuum in Massachusetts. And while we have you with us here this morning, MHA is excited to be hosting our first in-person annual meeting in 3 years this January. We have a jam-packed agenda with healthcare leaders from across the care continuum, along with state and federal public officials, including U.S. Secretary of Labor, Marty Walsh, all coming together to discuss the biggest challenges and opportunities that our system faces. The first day on January 27th will be devoted to the future of work, and our Friday program will focus on supporting the people who make healthcare happen, as well as the stability of our system as we look to the future. And we'll certainly be having some fun along the way. Registration is officially open, and you can take advantage of the early bird rate through next Friday. There has never been a more important time for collaboration and constructive dialogue in healthcare, so we hope to see you in Boston in January, along with the other events we have lined up in 2023. You can visit us at mhalink.org for more information on those. Now, it is my great pleasure to introduce our moderator for this morning's discussion, MHA President and CEO, Steve Walsh.
Thank you, Valerie. And it's great to be back with all of you for another episode of our Executive Insights series. I know many of you joined us for these sessions throughout 2022, which has been by every account the most difficult year that our system has ever faced. We hope these short webinars have provided you with just a ray of hope as you do the hard work of saving lives and changing lives. The focus and determination of our healthcare leaders and all of you has certainly made a tremendous difference to our team here at MHA and the communities you serve. Mike Lauf is one of those leaders, and we are proud to have him with us today. Mike is one of the longest serving CEOs in the Commonwealth, serving at the helm of Cape Cod Healthcare since 2010. He oversees a regional health system with more than 450 physicians and 5,300 employees, all contained within 2 acute care hospitals, the largest home health services agency on the Cape, a skilled nursing and rehab center, and an assisted living facility, and numerous other health programs. Mike was previously Cape Cod Healthcare's Chief Operating Officer, a position he also held at Bristol Medical Center in Tennessee. He is also a member of MHA's Board of Trustees and our Executive Committee. Now, there's much more to his background and bio, but I want to save that because that's going to be one of the things we talk about this morning. Mike, thanks for your ongoing leadership, and thank you for joining us this morning.
Thank you, Steve.
To kick us off, Mike, you have spent most of your career in healthcare, but many people might not know that you spent the better part of a decade on Capitol Hill as a key staffer to Representative John Murtha. Can you talk a bit about that experience and what sticks with you from it today?
Well, good morning, everybody. Happy holidays. Steve, you know, you think about luck in life and opportunities. And, you know, I happened to join Congressman Murtha's staff because he interviewed me at a request of a friend. And I never said one word in our 45-minute interview. I listened to him as he carefully told me about government and leadership and what it meant to serve his district. And he hired me as a volunteer because he said I was the first person that listened and didn't speak. And that was kind of the pathway forward with him. I got a chance to work with one of the best people I've ever met in my life. I got a chance to travel with him and go and serve and talk to every constituent in our district, to learn about leadership, to learn about principles and ethics and what it meant to serve others. He sits above my desk today in a picture, still recognizing the importance that he's had in my life and all the leadership principles that he taught me. He really was a selfless person that not only cared about his district, but our country. He served in the military. He really looked out for the underdog, and he wanted to improve everyone's quality of life. And to me, that's kind of how he has influenced me and how my career has evolved.
So just down the road from where you sit today in Hyannis is the Kennedy compound and home to our own Senator Kennedy. And we're living in such a highly politicized world now. But Congressman Murtha had this strong relationship with Senator Kennedy. They both reached across the aisle to get so many things done. What can be learned from the relationship that they had and they had with the other people that they serve with, regardless of party, in our current society?
I think we all could learn more from not only Senator Kennedy and Congressman Murtha, but also Speaker O'Neill, who was Congressman Murtha's mentor. They had relationships with everybody. Oftentimes, they didn't agree with the other person's opinion and or perspective, but they still had a way to form relationships and evolve with them. They listened to others. They had thoughtful responses, and then they formed opinions based on education. And that's what is missing in today's world. You can have differing opinions and still have a relationship. And that's what we need more of. How do you put yourself in the other person's position and try to understand what they're going through? And that's what Congressman Murtha and Senator Kennedy did far better than most people and far better than I ever will. They absolutely had the ability to listen to somebody else and create a consensus to improve that position. And we need far more of those leaders in today's world. Yes, they were in a party, but more so they were Americans, and they thoughtfully cared about each and every person. And I long for those days. When I was on Capitol Hill, we reached across the aisle all the time. We worked with each and every person. And yeah, I think about Speaker O'Neill, and he and President Reagan had epic battles, right? But behind the scenes, they worked to form, a consensus and do what was right for the country. And I know Congressman Murtha did that, and I certainly hope that I do that a little bit here at Cape Cod Healthcare.
Do you have maybe you can't share it in front of a couple other people, but do you have a favorite Congressman Murtha or a Senator Kennedy story that you can share with us this morning?
Well, I have a few stories. I think one of the times, talking about humility, I worked so hard on we were traveling from our district in Johnstown, PA, to go to Philadelphia to meet with Mayor Rendell at the time. And we didn't have, MapQuest and all the other issues. So the day before I drove to Philadelphia, a 5-hour drive to figure out every single turn, where I was supposed to be, where I was supposed to get the congressman. I got there without problems. The following day, the pickup time was 5 a.m. I showed up at 4:30. I had all the papers that he wanted to read, the coffee. We were ready for the trip. As I walked up the stairs to knock on his door, he was sitting on the porch at 4:30 a.m. and said, "Good afternoon, Mike." I was already late. So, that was kind of the bedrock of who he was. And I remember I had the good fortune to have a lunch with Congressman Murtha and President Clinton. And they were sitting around and talking about many differing things. And the president started coming down on Mr. Murtha pretty good about a particular subject. And he looked at the president and said, "It's his fault." And he pointed right at me. So it was pretty fun. Most of the things I can't really talk about in this forum, but they were incredible leaders. And the Senator Kennedy was incredibly gracious and so kind and thoughtful. It was an honor to get to meet him.
Well, I suppose it's good to be in the room with President Clinton, even if you're being blamed for something. A lot of good things happen during those times. You and I are a bit of a kindred spirit. We share a background in politics and then ended up in healthcare and now working together, which is certainly an incredible joy for me. But what drew you from politics, public service into healthcare? How did you make that transition?
I had the good fortune at the time, the Department of Defense, which Congressman Murtha was the chair of the Appropriations Committee for the National Security Subcommittee. And we were the largest funder of breast cancer disease research and prostate disease research in the world at the time. And I started to meet incredible scientists and physicians and leaders in the space. And during the end of my career, it became evident that I really thought that you could make a difference. And that was the one thing that the congressman always instilled in me, that one person can make a difference. And, he told me, his advice to me when I was leaving was become an expert, make a difference, you'll never look back. And that's exactly what healthcare has provided me. The opportunity to work in a space that helps others. Each and every day, I represent 5,300 incredible people that do nothing else but to serve others. What an honor, what an opportunity. These folks, look at the COVID pandemic, where all of us on this call, all of our frontline staff, all of our physicians, they ran in. Think about that. The world didn't know, but our healthcare providers ran in. And to have the opportunity to work with people like that, that's what drew me to this incredible profession. I come from a family of nurses, and I used to sit around and listen to them talk about people like me now. And I said, gosh, I'll never get into healthcare. And all these years later, I'm in healthcare. And I still talk to my mother every day, and she reminds me of the incredible opportunity that I have and to approach life with humility. She raised 4 of us alone, and I've never forgotten that. And that's what still motivates me today, to work with all those folks that are truly leaders. They care about society. And there is no greater role or mission that I could ever imagine in my life than to be in a space like this, where you can impact others in such a positive way.
And your mom is still in Pennsylvania, and she is telling me now.
She's still in Pennsylvania. I asked her to move up here, and she said, I'm not riding your coattails, Mike. I have my own.
How old? I know you were back for a big birthday recently.
Yeah, she's 81 and still working and still having a great time in life, and still controlling the Lauf orbit from Johnstown, PA.
Yeah, that's good to hear. And I know you're getting back there for the holidays, which is pretty special. Another special place you're in now is Cape Cod. And I know that you are incredibly proud of the work that you and your team are doing there, but you now have a year-round population. I know you have the swell of summer visitors, but most people are now remaining, right, post-COVID. Few other health systems face this sort of dynamic where it was a swell and then a bit of a lean time, and now it's a year-round swell in a place that was really built to be different 8 months a year. Can you walk us through the unique care needs of the Cape Cod community and how it's fluctuated now post-COVID?
Yeah, thank you. So we have grown from 215,000 year-round residents to 230,000 year-round residents since the pandemic began. And what's so unique about the Cape is we're the 3rd oldest county in the country. So largely 32% of our population is over the age of 65. So clearly access to medical care is the key. And, we're used to dealing with the summertime, the 4 months where we swell to 750,000 people from Woods Hole to P-Town, right? But now all year round, we're dealing with such a diverse and interesting population that, as I mentioned, is largely elderly. And we have to create the necessary touch points, the necessary access. So we have a role on the Cape: 15 minutes to primary care, 30 minutes to specialty care, and 1 hour to a hospital. That's not scientific. It takes an hour from P-Town to get to Hyannis. But the fact of the matter is we have to create the necessary touch points for our patients so we meet them where they are. It's not about where we want them to be. It's how can we get to where they are. So we've had to focus so much on primary care, urgent care, specialty care, focusing on cardiology, orthopedic care, trauma care, neurosurgical care, neurology. How do we create centers of excellence to deal with the Alzheimer's epidemic? How do we continue to evolve to meet our patients where they are? We can't be overly selective. We are the only stop. We are we are truly Cape Cod Health, Cape Cod safety net. So we have to have a full range of services to meet our community exactly where they need us to be. And we take our mission very seriously to accomplish that.
Yeah, when you and I started working together some years ago, I had the opportunity to visit Falmouth when you were opening the new ED, which at the time was state of the art and great for that side of the Cape. And recently on a visit down with some members of your legislative delegation, I walked through your Hyannis ED. Wow, is that a really special place to deliver care? The layout of that is unique. I mean, could you just talk a little bit about that emergency department? And the other thing I want you to talk about is the people that service it, because everybody was so incredibly friendly to us and seemingly accepting their job as the vocation that it is. And it's different than I've seen in some other places. You talk a little bit both about the facility, but also about the people that house the facility.
Well, I think we designed the emergency room completely through the eyes of the caregiver. So we had physicians and nurses and techs and aides and housekeepers involved. How do we design an ER to meet our patients' needs? And we also had it very specifically designed, both ERs, both in Hyannis and Falmouth, with the geriatric population in mind. We have natural light coming into each and every room. But the expansive nature of the ER was designed to make sure that we could create specific pods to approach the care that we provide. And we built a 72-bed ER, and today we've actually flexed that up to 92 beds because of volume, because of behavioral health crisis and other needs. But we really designed an ER to make sure that our caregivers could have visual sight lines into each and every patient, that things like the height of the bed or the stretcher in the room, where they were documenting, where things as simple as a TV and a clock were. We really got down to the specifics and obsessed about how the patients would perceive the room as well as the care that we provide. And what's so interesting, the day that you toured through, we had 94 people in our ER, and you commented how quiet it was and how calm it was. And that's a testament to our ER staff. These folks, from the pandemic right through today, deal with over 300 patients every day. They're dealing with 25 people that are boarding. They never say no. They never say, what do you have or what do you believe? They simply ask what's wrong. The emergency department is truly a unique field in which it's so selfless. It's how can we help you? How can we take care of this acute condition and improve your your life? Excuse me. So we're what they do each and every day. I mean, in the summer, we'll see 400 people on July 4th, and each and every person is in their room within 25 minutes, 90% of the time, seen by a doctor within 40 minutes, 90% of the time, and discharged within 3 hours unless you're admitted. They are a finely tuned orchestra, both hospitals, and I'm so proud to work with them.
Yeah, I'm sure there are challenging times, but it was remarkable, the lack of chaos, the incredible command that your team seemed to have over what was happening there. And we did notice how just quiet it was, which is obviously a better way to deliver care. So you're dealing with a ton more permanent residents, some tail on the COVID, RSV, a flu season. I mean, you're seeing patients everywhere, right? Everywhere that you have space, you're seeing patients. How's your team doing? And is there a way out of this? What happens in the next 2023 in terms of this huge swell of patients that all of our facilities, but particularly yours today, have been facing?
Well, the way out, I think, is empowerment and communication and culture. We have to listen more as leaders. We have to listen to our staff more, understand their needs and desires, and actually take their input and improve the surroundings that we have. I think the culture of positivity. I never complain. I just, it's my rule of thumb, and I learned it from Mr. Murtha because frankly, he told me nobody cared anyways. What we have to do is look at the positive aspects of all the touches that we'll provide today. Even the person that is so difficult to deal with, the opportunity that we have to improve their position in life is so meaningful and powerful. So empowerment of staff, that culture of positivity, and then education, provide the opportunity for others to grow in their careers. And I take that so seriously. We recently did a program in which we developed a job position where we were hiring people into our organization that couldn't speak English. And we saw the need, and frankly, the head of our environmental services division came to us with the idea. So we've hired 16 people now that don't speak English, but we now have a curriculum in our organization where we're teaching them English as a second language. And we're also now teaching, some of our leaders have gone and said, well, let's learn Portuguese, let's learn Spanish, let's learn other languages and find ways to grow and evolve. So, just those leaders and pathways. There's so many leaders that surround me now that started out as frontline nurses that are now managers, directors, COOs, giving them that opportunity to realize their potential. It's not because of me, it's because of them. And that is so exciting in life, giving people the opportunity to reach their potential. And that's what Congressman Murtha did for me. That's what my mom did for me. And that's what I hope I do for the rest of our organization.
Yes, sticking with workforce, you have been a leader on our CEO-driven workforce task force on really trying to understand the needs, both present and then pipeline for the future. How do we attract more people? What do we do to have people have that same aha moment you had, where you could really make the difference in the lives of the patients that you care for? What do we do to get people into this field?
I think we have to express and show the opportunity. This is a field in which you can improve somebody else's life. And there's so many people that have that calling, but show people the opportunity and the satisfaction that comes from being a part of a dynamic team, whether you're in the IT field, the finance field, the nursing field, environmental services, PR, whatever it is, it's a team. I love being a part of the team. I always say to folks, look at the name on the front of the jersey. It's far more impactful than the name on the back. When you put the organization and our mission first, you're going to like where you end up each and every day. And I think that's what we have to stress. Imagine coming to work every day knowing that you're a part of the community safety net. You're a part of something far greater than your own household. You're taking care of society. That's what we have to stress to folks. We have to show them that not only can they help, but they can improve their own life. They can see and realize far greater opportunities. And that's what healthcare has done for me. And I know it does it for each and every person on our team.
So 15 years there, the place looks, feels, treats differently than it did before. Really an amazing growth and evolution and vision under your leadership. What's the biggest change? You look back 15 years. What do you see as the biggest difference today than when you started?
Well, I think the biggest difference we have is 20% of the Cape chooses us now, more so than it did 15 years ago. So we had a market share roughly of 58%, which today is about 75%. And knowing that we have far more many people coming into our facilities. For instance, we opened 6 urgent care centers over the past 7 years that touched 120,000 people last year, creating those necessary access points. And also knowing that we have to be very, very good for each and every person that walks through those doors. In organizations like ours and communities like ours, we don't have the good fortune to make mistakes, right? We do, of course, but reputation is so impactful. When we make a mistake, it spreads like wildfire through our community. So we have to continually search to find ways to do it better, to find ways to attract more, and to find and also be humble in our mission. So I think the greatest change is how many people use us now, how many more specialists now that we need, how many more primary care physicians we need, and how many more nurses and other things we need. So it's just growth, and with that creates challenges, but we see them as opportunities. How can we continue to meet the needs of the Cape?
So I know you're a person that always likes to look forward. What's on that checklist? What's that immediate needs for exciting opportunities in 2023 for you and Cape Cod Healthcare?
Well, one, to grow the workforce. We have to make sure that our team knows that we're there for them, and you do that by building a workforce. And we have a partnership with the Cape Cod Community College and UMass, where we have our own nursing program. I mentioned English as a second language and making sure that we're growing a diverse workforce. We have to be there for our employees, and then you think about Alzheimer's and dementia, and how do we grow our neurologic division? And we're all suffering from not enough, but how do we create more? And then all those access points that I touched. When somebody needs a rheumatologist or somebody needs a cardiologist, we have to make sure that we can get them in. And also leveraging IT. I think information technology can be such a powerful tool. We never want to get rid of the person, but how do we empower the patient? How do we push information to them? How do we let them know that there's screenings available to improve their lives? So, workforce development, making sure that we have the right access points, and also leveraging IT, I think, are the key themes for this year.
A couple of quick questions that we like to ask our guests. First job.
I worked at a municipal golf course, 9 holes in Johnstown, PA, in the pro shop and the grounds crew. So I started at 6 in.the morning, cutting greens and changing cups, and finished the day cleaning bathrooms in the pro shop. And it's still my favorite job of a lifetime.
You're still golfing, enjoying it?
I still golf. Yep, I love it.
Good. We're coming on the holidays. Favorite holiday tradition?
I have a little say Clark Griswold in me. I love to put up outdoor illuminations on Thanksgiving morning. So while most people are getting ready to eat, I kind of obsess about getting all the decorating done in the outside of the house. And begrudgingly, I bring my kids with me a little bit.
I'll digress. My four kids, as you know, are fairly young. We put on Christmas Vacation the other night. I put it on with them. About a third of the way in, I said, this was not a good idea. Our company Griswold is not for every age group. You want to have dinner with one prominent figure, dead or alive. Who is it?
Winston Churchill.
And a question we ask all of our guests. We have a lot of emerging leaders that listen to these calls. What advice do you give to emerging leaders that are coming up now, either in healthcare or in other leadership positions?
You know, it's exactly what I started out with. Listen, be patient. Your voice is powerful and don't lose it, but be patient and use it judiciously. Become an expert, and then you'll love where you end up. I was hired as a volunteer for a year and a half before I ever got one paycheck from Congressman Murtha. And that was because I saw it. I saw the opportunity. I volunteered to travel with them. We all want to get to the end point so quickly today. And sometimes it takes patience. And I think listening and being humble and being patient are the keys to success.
I'll just pause for a minute. If anybody has any quick questions for Mike, you can throw those in the chat as we're beginning to come to a close. And I have one, Mike. We've been working together for a long time, and you're now slated to be MHA's board chair in 2025. Any thoughts on what our system might look like by then, or what you hope it will look like by then as you become the leader, not only of the Cape Cod region, but a leader among equals of all of our healthcare facilities in the Commonwealth?
Well, I hope that it looks a lot like it does today. And I say that because I think communities need hospitals. And I think society needs academic medical centers. And I think that we can bridge those divides with information technology and sharing and growing. I think that there's such an impactful role in healthcare. And what's so interesting about society is we forget quickly, right? Because we're on to the next. We can't forget what hospitals have meant to this society for the past 3 years. We have proven our worth because we have been safety nets, and we're still proving it today. And that's what we have to focus on: the good, the quality, the care, the access. We can't get into reimbursement. We can't focus on all the negativity. We have to position ourselves as the industry of opportunity and quality. And that's what I want to get to. I want to give people the chance to know that if they get into healthcare, they're going to be fulfilled in life. So I see great things for healthcare. We're going through a turbulent time. We're dealing with many issues all at once. But if we focus on the right things, which is the care that we provide, I'm quite sure that we'll end up in the right spot.
Got a question in the chat on primary care. I've heard you talk about the vision to expand primary care. You just talk a little bit about that being a challenge on the Cape and what can be done to address that.
Yeah, there's never enough primary care anywhere. And I think if you polled our community, they would give me negative marks for primary care. I always try to be objective, and I think I could do primary care better. But I would say we're trying some new innovative models right now in which I want to go back to the future. I believe that having primary care physicians in our community that not only have a clinic, but also still come into work in the hospital is the key to our future. And we're doing a clinic in Falmouth and a clinic in Hyannis where we have physicians and NPs and PAs not only having clinic, but also then working as hospitalists in our hospitals. So I think the key is to evolving this incredible field. Primary care is so important. It needs to be elevated from the government's perspective, right? We have to put them back at the forefront of medicine, and I think we'll continue to evolve. But we're going to have to try new models because currently, I don't think anybody could say that they're satisfied with what we're doing in primary care, and I think our patients would agree with that.
Good question. I think it might have to be our last in the time. But how do you keep up on being a great leader with the way healthcare is changing?
I don't know that I have a recipe other than just optimism. I read a lot. I don't watch a lot of TV, sports, but I read and I listen and I love people. I just like being around people and I love what they do and I learn from them. And I think just that optimism has empowered my team to do great things. They're the people that are responsible for our success, not me. I'm just a part of it, and I'm so excited to show up every day. Every day the door opens and I get to do this job. I'm thankful. And I'm just thankful to not only be here, but to be a part of this, Steve. Thank you.
And Mike, we're certainly thankful for your leadership, all you've done for the community that you serve, but all of us through COVID and beyond. Your insights, your leadership, your collaboration was invaluable, particularly around some of the efforts to vaccinate our residents. And really, you've been a dynamic leader in a difficult time. Unfortunately, our time today is coming to a close. But I want to thank you for taking the time to be with us this morning. Thank you for all you're doing on behalf of patients, our healthcare professionals, and our communities. I will close with what I saw in the chat, which I think is exciting because it's kind of the way we started the conversation with one of the leaders that is listening this morning saying that they were proud to say that they started their leadership role at Cape Cod Health. I think that is exciting for you and exciting for them, and I know you believe the same. On behalf of all of us at MHA, I hope you have a safe and restful holiday season and a new year that brings some new hope. Thank you for spending your morning coffee with us. And we look forward to seeing you at the next Executive Insight session in 2023. Thanks, Mike, and happy holidays to all.
Thank you.